to show you where they are specifically. First, we'll start off simple at the top with the cephalic, which is the head. Now, if you go to the forehead right here, that would be the frontal. Nose would be the nasal. Eyes would be the orbital. The buccal would be the cheek. The oral would be the mouth. And then the cervical would be the back, the neck. The mental would be the chin. The acromial would be the shoulders. The sternal would be the breastbone itself. The axillaries would be the armpits of the body. The thoracic would be the chest area. Mammary would be the breast. The whole arm would be the brachial. And the antecubital would be the front elbow. And then the popliteal would be the posterior knee. The olecranial would be the back elbow. And then the sural would be the calf. The carpal would be the wrist of the body. Palmar would be the palm. Digital would be the fingers and toes of the body. The patellar would be the anterior knee. Crural would be the leg. The tarsal would be the ankles of the body. The hallux is the big toe. The occipital is the actual base of the skull. The vertebral would be the spinal. The scapular would be the shoulder blades. Dorsum is the whole back. Lumbar would be the loin area. The sacral would be between the hips in the back. The femoral would be the thigh. And the calcaneal would be the heel, and the plantar would be the sole. I'm going to go over more medical terminology, specifically medical terms. First, I'll start off with the anterior or ventral, which is the whole front of the body. The posterior would be the whole back of the body, or dorsal as it's called. The superior or cranial would be the upper half of the body, while the inferior is the lower, or the caudal. Medial would be the midline of the body, going towards the center, while the lateral is going outside, away from the midline. And then intermediate would be between these two directional terms, so it would be somewhere in between lateral and medial. Proximal would be the point of origin of something, and then distal would be away from the origin, while superficial would be a cut that's external or just on the surface or not very deep, so light cuts. And then while a deep cut is internal and beneath the surface, and you actually get deep inside there. So that's it. Specific cavities and what organs are located within those cavities. First, we have the cranial cavity, which has the brain. Then we have the vertebral cavity, which has the spinal cord. Now we'll talk about the thoracic cavity, which has lungs such as the lungs, the heart, the esophagus, and the trachea. Now if we go down below to the abdominal cavity, we have such things as I already described as the stomach, the liver, the spleen, the gallbladder, and the kidneys. Now if we go down to the pelvic cavity, we have terminal end of the large intestines, the urinary bladder, and internal reproductive organs of the body. Now if we go to the pleural cavity, it contains the lungs. The pericardial cavity contains the heart, and the axial portion includes the neck, the head, and the trunk of the body. Now we're going to look into specific areas of the abdominopelvic area and their quadrants. First, if we split the abdominopelvic area into 4 parts, we have the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. Now we can also split this into more specifically 9 abdominopelvic regions, which helps us be more specific in describing specific parts of this region. So first we have the right hypochondriac region, and then in the middle of the top would be the epigastric. This would be the left hypochondriac region. Right below the right hypochondriac region is the right lumbar region. In the middle, in the completely center of this area would be the umbilical region, and then over here would be the left lumbar region. Now, right below the right lumbar region would be the right inguinal region, and then in the middle at the bottom would be the hypogastric region or pubic, and then all the way over here would be the left inguinal region. Now, this area also can be a way to describe where different organs are, such as in the epigastric region, you can see parts of the stomach and the liver, and on the right hypochondriac region is the stomach is seen, while on the left hypochondriac region, you can see the spine is in that area, while in the right lumbar, umbilical, and left lumbar includes pieces of the large intestine and small intestine. And as you get lower to the hypogastric and the inguinal region, you can see things such as the appendix and the urinary bladder. Now we're going to talk about the different tissues and its functions in the body, and specifically where they're located for the most part. First, we have the four different type of tissues we have are connective, epithelium, muscle, and nervous. For connective, it's parallel bundles of fibers that connects bone to bone. So that's mainly where connective tissue comes into play in the human body, and also connective tissue makes up part of the pancreas. Epithelium is another tissue where the cells of this tissue may absorb and or secrete substances. Also, it forms the endocrine and the exocrine glands, and it also lines up much of the respiratory tract. Also, it lines up the inside of the mouth. Open the mouth, please. That would be the epithelium tissue. And that's it for epithelium. Now we're moving on to muscle. We have cells contract to exert force. That's why our muscles are used to, move our body for the most part. And also, it contains contains thin and thick filaments of the protein. Now moving on to the nervous tissue, it forms the brain and spinal cord for the most part, and also it also uses electrical chemical signals to carry out its functions. So those are the tissues and its functions in the body.